So we have basically patients everywhere in both sides of the unit.
This is the epicenter of the USA's battle with the Delta variant. If proof were needed of the effectiveness of vaccines, they lay in this COVID unit, hooked up to machines, struggling to breathe. Debbie, the nurse manager, can't believe they're in this position again, only this time it's worse. And with more than 95% of these patients unvaccinated, it feels avoidable.
You've gone from having 2 COVID patients to having hundreds in the space of how long?
2.5 weeks. It's all just start. So all the changes, everything just start. Our ICU beds are full. You know, we're taking care of 5, 6 patients at one time. That's not an easy task. So to see that people still kind of like in denial and don't think the vaccine can help, or even don't put the mask because, you know, it's not mandatory, it's really upsetting.
Florida accounts for 6% of the US population, but 20% of the current coronavirus cases. It also has one of the lowest vaccination rates in the country. Rooms here that should be for one patient are now shared. They're also younger than before.
Hey, Mr. Johnson, how you doing?
Lawrence Johnson has been here for 22 days, infected first by misinformation around vaccines, now infected by the virus itself. Why did you not have the vaccine?
Because every time you turn around, you hear all different kind of stories and stuff, and you get scared and confused. It is best to have it and don't need it than to don't have it and need it. I am a living witness. Had I got a vaccination, I wouldn't be here right now.
They're not just fighting the virus in Florida, there's a culture war raging on mask wearing. These parents want masks to be mandatory when schools in Jacksonville return after the summer holidays next week. But the state governor says that's not going to happen, despite the surge in cases. This paediatric doctor is concerned about the long-term effects of COVID.
But kids do get sick, and they do get hospitalized, and they do die. And the long-term complications of COVID in children, we are seeing those. If I get COVID infection, unfortunately, and I may get long COVID. I may have, if I'm lucky, to deal with it for 10 years, 20 years. A 5-year-old child may have to deal with it for 80 years.
Here they pray for the patients and the nurses, knowing that this situation is likely to get worse before it gets better again. Martha Kellner, Sky News, Jacksonville.